babies are wheeled out of hospitals and nestled snugly in their mother's arms, but in many cases this is not true. Many babies are born with specific diseases that affect them. For example, epidermolysis bullosa. As you see in these images, there are blisters that formed around the baby's parts of the body and the skin. Epidermolysis bullosa is a disease where the skin is very fragile, and with any amount of friction or damage can cause severe trauma and for the cause of the skin to fall off. This is a girl, Lizzie Fernandez. She was featured in an article written by her mother that detailed their life and their struggle with caring for her disease. Epidermolysis bullosa is a genetic disease that is presented with fragile skin and is caused by a mutation in specific proteins in our body. The symptoms of EB include fragile skin and blistering, but there are many complications that come with this disease. They include anemia, death, eye disorders, blindness, infection, loss of function of the hands and feet, muscular dystrophy, which is a breaking down of the muscle tissue, periodontal disease, which is gum disease like gingivitis, severe malnutrition, and skin cancer. There are three major types of EB. There are epidermolysis bullosa simplex, junctional epidermolysis bullosa, and dystrophic epidermolysis bullosa. These three diseases are classified by their genetic mode of transmission and what parts of the skin they affect. This picture shows the different layers of the skin and where diseases affect the parts of the skin. EB simplex affects the epidermal layer of the skin, which is the first layer of the skin. Junctional epidermolysis bullosa affects the parts of the skin between the epidermis and the dermis, and dystrophic EB affects just the dermal layer, which is the second layer of the skin. The specific cause of epidermolysis bullosa is the malformation of hemidesmosomes in the skin, which are specifically caused by a mutation in the subunit of integrin. These integrins are important proteins that are involved in the structure of the skin that help connect the epithelial layer of the skin to the underlying basal lamina. This image is an immunofluorescence analysis of patients with normal hemidesmosome structure and abnormal hemidesmosome structure. This green part in the picture is the connection between the epithelial layer, which is the blue, and the underlying basal lamina. As you see in the normal picture, the green layer is distinct, and you can see it's very thick, but in the normal, it's very thin and weak. So that results in the fragileness of the skin. EB is diagnosed usually by family history as a genetic disease. There's some family history involved in detecting it, and also by the symptoms of your skin falling off. Currently there is no cure, but scientists have been working on gene therapy to try to fix the proteins that are defective, that come from the genes that are coding for them. But there are also treatments to handle the complications, especially the infections. For example, caring for the wounds that form. Also, because of the cells in your esophagus are the same cells that are attacked by this disease, patients have trouble eating because it can damage their esophagus. So one way to treat it, help treat it, is for nutritional support, so the foods don't scar or traumatize their skin. Also, prevention of trauma, just being safe, so you don't get in an accident or hurt yourself, or they hurt themselves. And also iron supplements because of the anemia that comes with this disease.